Hi, I'm the author Seongjun Kim, and thanks for giving me the opportunity to make an oral presentation. My topic is the method of sparse strict artifact reduction when the only sparse PST data are given, which is based on Weakly-supervised learning. Let's start with background of the research and the motivation for doing this topic. First, we need to know about sparse PST. Sparse PST is decreasing the number of projection views during CT scan to reduce X-ray radiation dose to the patient. Here we can see full view and sparse PST image. However, sparse PST image had streak artifacts due to sparse sampling during CT scan. To reduce streak artifacts, conventional methods such as iterative reconstruction have been proposed. IR method iteratively optimizes both CT data fidelity and image regularization terms, and total variation is often utilized for prior image. However, IR calculates forward and back projection during optimization, requiring a huge amount of computational cost. Thus, its usage is limited in the medical imaging field, where the real-time application is required. To overcome these disadvantages of IR method, deep learning-based methods, including convolutional neural network, are developed recently. This approach generally has a high performance in reducing streak artifacts and enables real-time application. Several CNN-based methods for sparse PST have been proposed in various ways. For network architecture or loss function, many methods optimize the parameters of several convolution layers and loss combination to achieve the best performance. Moreover, the hybrid domain approach is also developed to contain useful information in both image and sinogram domain. However, most of these methods are commonly based on fully supervised learning. Fully supervised learning in sparse PST means that CNN requires the training and test dataset with paired sparse view and full PST images, where the sparse view and full PST images was set to the input and the target of CNN respectively. Many methods generate sparse PST image by computer simulation using the full PST data. However, in real practice, acquiring the full PST data from the patient can cause a potential risk for increasing X-ray radiation dose, and it is against the ALARA principle. So the importance of Weakly-supervised learning is increasing, which does not require the pairs of artifact-corrupted and artifact-free images during CNN training. In other medical imaging fields, such as denoising or metal artifact reduction, several methods based on Weakly-supervised learning have already been proposed. However, in sparse PST, there is no Weakly-supervised learning method to reduce streak artifacts. Therefore, we propose the method of streak artifact reduction method when the only sparse P data are given, which is based on Weakly-supervised learning. Now, I would like to talk about the proposed method. This is the whole schematic diagram of the proposed method, and I will introduce it step by step. The first step is dataset generation for CNN training. For CNN training to reduce streak artifacts, it is required to set the images with strong and weak streak artifacts as the input and target of CNN respectively. Since the only sparse PST data are given to us, we should acquire the pairs of input and target from the given sparse PST data. For this, we generate the image that has stronger streak artifacts than the original streak artifact in given sparse PST image. We denoted this image as a Sparsier PST image, where Sparsier means more sparse than sparse. Here, the method of Sparsier PST image generation is described. To make streak artifacts stronger, it can be implemented by decreasing the number of projection views. Therefore, we downsample given sparse sinogram by half and acquire Sparsier view sinogram. We then reconstruct Sparsier view stick image from Sparsier view sinogram using filtered back projection. During generation, we set the downsampling ratio as 2 because Sparsier view stick image will be significantly corrupted when the ratio is bigger than 2. Since we generated Sparsier view stick image by downsampling from given sparse view sinogram, the streak artifacts in Sparsier view stick image will be amplified while keeping the directionality of the original streak artifacts. Therefore, we regard Sparsier view stick image as the input and given sparse view stick image as the target, and then train CNN. After CNN training, the network is trained to reduce streak artifacts. Since the sparse view stick images are given to us, we applied the trained network to those images to reduce streak artifacts. However, one iteration is not enough to reduce streak artifacts, so we performed more than 2 iterations, and the number of iterations is defined as follows. For example, when the full view, sparse view, and Sparsier view was given like this, the number of iterations is calculated as 2. When the trained network is applied several times, the resulting image of iteration reduced streak artifacts gradually, whereas it was getting blurred as the number of iterations increases. This is because both Sparsier view and sparse view stick images used for CNN training have already been corrupted their structures due to severe streak artifacts. So the network focused more on reducing streak artifacts than preserving those structures. To reduce image blurring, we estimated the original streak artifacts in given sparse view stick image from the output image of the last iteration. The streak artifact estimation model is simple. The left image is the output image of the last iteration and gets into the streak estimation model. The right is the schematic diagram of the streak estimation model. For this model, we first reconstruct full view, sparse view image from the output image of the last iteration by sequentially applying forward and back projection with full and sparse projection views respectively. We then subtract each other to estimate streak artifacts. After the estimated streak image is generated, finally, we can acquire the final output by subtracting the estimated streak image from given sparse view stick image. Now is the part of data preparation and CNN training configuration. For SCAT dataset, we use abdomen regions of SCAT phantom and divide it into training, validation, and test set. The previous CT images were generated with 512 projection views, and they were used only for test. For sparse CT images, they were generated with 128 and 64 projection views respectively. For clinical dataset, thanks to Mayo Clinic, we acquired the data of 10 patients. We again extracted the abdomen parts and divided into training, validation, and test set. To train CNN, we set the training configuration like this. Since we focused on developing framework rather than network architecture or loss function, we used simple unit structure and MSE loss for training. Now let's see the results. The first is the entire image results with 128 projection views on SCAT and clinical dataset. For comparison, we showed the method of linear interpolation, total variation-based iterative reconstruction, and FAP combined sequentially. LI method estimated the missing view data of sparse view sinogram by linear interpolation in view direction and matched it to the full view size. For TBIR method, we used total variation for image regularization term and balanced the parameters to have the lowest MSE scores. And FAP component is fully supervised learning method, which directly trains CNN from sparse visibility image to full visibility image. As we can see the results, FVP component reduced streak artifacts effectively compared to other results because it trained CNN with reference image as a target. The proposed method also produced good performance in reducing streak artifacts while preserving fine details. These results were generated from 64 projection views on SCAD and clinical dataset. From the results, FVP component also showed that the streak artifacts were reduced effectively. However, unlike the results on 128 projection views, the streak artifacts in the proposed method were not reduced well. Since the degree of image corruption is on 64 projection views is very severe, the proposed method is limited to estimate the original streak artifacts. In this slide, we calculated normalized RMSE and SSM scores. Both NRMSE and SSM scores are the best on FVP component, and the proposed method generally had the second best scores. Because FVP component reduced streak artifacts effectively while reducing the noise together, however, the proposed method still has the noise. From the results on 64 projection views, the proposed method had bad SSM scores. As we can see, the streak artifacts in the proposed method were not reduced effectively in the previous slide. To observe more fine details, we compared the ROI image results with 128 projection views on SCAD and clinical dataset. For the ROIs of both SCAD and clinical dataset, it can be seen that the signals indicated by red and yellow arrows were blurred in FVP component. In contrast, the proposed method produced the best ROI visual similarity to those of reference image while preserving edge sharpness. We also compared the ROI image results with 64 projection views on SCAD and clinical dataset. Although the proposed method did not reduce streak artifacts better than FVP component, the proposed method preserved ROI signals better than FVP component. In our framework, we trained CNN and iteratively applied the trained network to given sparse visibility image to reduce streak artifacts. To examine the performance of iterative streak artifact reduction, we compared the results of the proposed method with different iterations, and the number of iterations was set to a maximum of 5. We performed this experiment on SCAD dataset with 128 projection views. For the proposed method with iteration 1, each difference image had more edge errors than the results of other iterations. These errors gradually disappeared as more iterations are conducted. For the quantitative results, FVP component had the best NRMSE and SSM scores. Within the proposed method, the results with iteration 2 had the best scores compared to the other iteration results. In this slide, to examine the effect of streak estimation model, we did not apply streak estimation model after iterative streak artifact reduction procedure. We also performed this experiment on a SCAD dataset with 128 projection views. As the number of iterations increases, the streak artifacts were gradually reduced. However, it can be seen that the images were getting blurred. So we can confirm that applying streak estimation model is effective to preserve fine details. The last part is discussion and conclusion. To summarize and conclude, we propose the method of streak artifact reduction when the only sparse visibility data are given, which is based on Weakly-supervised learning. Through applying the trained network to given sparse visibility image iteratively, it was effective to reduce streak artifacts gradually. And from the estimation and subtraction of the original streak artifact, it was effective to find details. And from the results, the proposed method preserved anatomical structures better than FVP component. However, since the proposed method had the limited performance on 64 projection views, it should be further investigated to optimize the loss function or network architecture in future work. And for another further works, we are now doing experiments with more various projection views for SCAD and for sparse visibility data. And during generation of Sparsier visibility image, we set the downsampling ratio as 2 because of the degree of image corruption. However, the downsampling ratio 4 is also needed to be experimented for ovulation study. And for the quantitative metrics, we just calculated NRMC and SSM scores. However, the additional task-based quantitative assessment is needed in future work. This is the end of my presentation. Thank you.
Yes, the talk is open for questions. Okay, I do have a sure.
Thank you. Could you go back to your slides 22, 23?
23.
22, 23, fine.
I don't know.
Keep
The
going,
numbers.
keep going. Backwards. No. All right, this is good. So you compared different methods.
Yes.
Couple questions. Each method involve parameters.
Yes.
So how do you select the parameters for each method to compare?
For TBR method, we set the parameters to have the lowest MSA scores, such as more lambda or etc.
Okay. For example, you mentioned TVIR. That's not kind of an image. You probably saying in some of the literature, some of the papers in literature, you don't see that kind of artifacts. So
Yeah.
anyway.
Yeah.
Do you have any questions? I have one to see if you have done this work a lot. You done sampling from 512 to 128 to 64 by the factor of 2. So that integer-wise default, many people does that. For sparse view, since you are to Sparsier2Sparse,
Yes.
did you try to sampling from another from 2, maybe 1.2, 1.3, 1.5, go that intervals, see what happened? Because that will tell you about this sort of view, the performance go down. The true is jump very symmetry when you sparse in domains. So like in focus domain, right, they have different I don't know what's the difference. And I didn't try this one before, but in my group we discussed it. Maybe have different things since you have to integration. For example, if you compare 1.8 to 1.4, they gave us some intrinsic information how to make up your like a training stuff where you have different signal between the two downsampling rate. Okay, anyway, that's to work. Okay, talk. Let's get another